Okay, this is the first day of April at CDC. I'm David Sencer, and I'm interviewing Dr. Dan Blumenthal, a professor at Morehouse University School of Medicine, on his experiences in the smallpox program. He knows he's being taped, and he has signed a release. Good morning, Dan.
Good morning.
Do you want to tell me a little bit about who Dan Blumenthal is? How you got to be Dan Blumenthal?
Well, sure. I started out, I think, picking up maybe when I was in high school, really intending to be a research type of person, pursuing a PhD in a biological science. And
where did you go to high school?
Well, in a suburb of St. Louis, Missouri. At my college experience, and particularly a summer research experience I had, convinced me that I really needed to pursue an MD rather than a PhD, or perhaps both. My original intention was to go after both, but put myself in a position to do biomedical research as something that would be more immediately relevant to humans. By the time I did some more research in medical school, I decided I really didn't want to pursue a research career, but rather more of a medical practice career. And so I kind of changed my career direction again. I was then, I think, eventually headed for some kind of pediatric practice. But
where did you go to medical school?
Went to the University of Chicago. Actually, I went there because they had a good combined MD-PhD program, and that was what I thought I wanted to do at the time. But as I say, after a few more laboratory experiences, I decided that really wasn't for me. I wasn't a laboratorian. I thought I was a clinician, and maybe I still am to some extent. I got into public health as a result of the war in Vietnam. I was so opposed to the war that I just knew that I wasn't going to serve in the military. I was prepared to move to Canada if that was what was required. But I was looking for an alternative in the U.S. instead, and I applied to the Indian Health Service. I think today admission to the Indian Health Service would not be a problem, but in those days it was, so I didn't get into the Indian Health Service. And I talked to my father, who's also a physician, and he said, well, why don't you try applying to the NCDC, as it was known at that time, the National Communicable Disease Center? And I said, what's that? And he explained to me that it was a public health service facility located in Atlanta, and I did apply to the EIS, and I was admitted to the EIS. At the time, I really knew very little about public health. I really had learned almost nothing about public health in medical school, and very little more during my residency, but this was certainly an attractive alternative. So I learned about public health here at CDC, and clearly it made an incredible difference in my career. I still do practice clinical pediatrics, but public health is a major part of my life, and it is probably the biggest part of my career now.
Who was in charge of the EIS program when you were?
Phil Brockman was the director of the EIS at that time, and provided great leadership. I still talk to Phil from time to time. He's teaching at Emory, and we keep in touch.
What did you do in the EIS?
Well, I spent a year in the nutrition program, and then the nutrition program went out of business, and so I spent a second year and then a third year in the parasitic diseases branch, and did some work with Ascaris and other intestinal parasites here in the U.S.
How did you end up in India?
Well, while I was in the parasitic disease branch, a call, I guess, went out for epidemiologists to participate in the Smallpox Eradication Program in India, and I wanted to do it, I guess, for two reasons. One was because it was a noble cause. It was something that really sounded like it could make an incredible difference in health for people in India and around the world. And second, because it sounded like a great adventure. It was really working on the front lines of something important, and the front lines in this case were far away from places where American physicians usually work, far away from all the things that we know, and it sounded exciting and different and unusual, and that was very appealing to me at the time.
When did you go to India?
1974. I was assigned to Bihar, which is in the northeast part of India, just south of Nepal. And I was assigned to Samastipur district, which is, Patna is the capital of Bihar state, and from Patna you cross the Ganges River and go a ways further on and eventually arrive in Samastipur. We flew into New Delhi originally and had some orientation there, and then took...
Who did the orientation?
Well, Bill Fagey was there, but I actually don't remember. I remember the hotel. I remember the swimming pool, but I don't remember too much about what we did in New Delhi. I remember the train ride then from New Delhi to Patna in a train drawn by a coal-burning engine and cinders and smoke flying in through the windows, and it was done that way because Bill Fagey thought that he shouldn't send everybody by airplane because he was afraid the plane might crash. So some people went by plane, but I was with the group that went by train.
Who were some of your colleagues?
Steve Jones was in the next district over, Muzaffarpur. And when I got lonely for the company of a fellow American, I would get in my Jeep and drive over to Muzaffarpur. I probably did that 2 or 3 times during the time that I spent in India, and spent a couple of days with Steve sitting around and speaking American to each other, and then I was re-energized and could go back to work in Samastipur. There were a number of others of us in the surrounding districts, and I'm afraid I can't remember everybody's name, but I know that we did a couple of R&R trips to Kathmandu, which was a fairly easy hop from Patna to Kathmandu by airplane. So I had some good friends at the time whose names I can't remember now.
Were you working, did you have a Indian counterpart, or were you just sort of off on your own?
Well, I had a driver, I had a paramedical assistant, and for part of the time that I was there, I had a young Indian physician colleague who traveled around with me and shared responsibilities. I think that was maybe only for a month or so, though.
What sort of duties did you have?
Well, the basic program was to follow behind my Indian colleagues who were permanent workers in the healthcare system to ensure that the search for smallpox cases and smallpox outbreaks was being appropriately carried out. And so on a typical day, I would visit the health office, the local health office, where posted on the wall was a list of all the outbreaks that were being worked. And I would say, let's go to that one, just kind of picking one at random. And typically the local health officer would say, no, you don't want to go to that one. That one is far off of the paved road. You'll get stuck in the mud. It's very difficult. You'll have to walk. I suggest we go to this one, which is right on the paved road. And I'd say, no, since you've told me that, now I know that I want to go to the first one that I picked. And so we'd get in the Jeep, and he was right. We got stuck in the mud, and so then we'd have to get out and walk, and we'd eventually get to the outbreak. And of course, few people there had been vaccinated, and it was typically the work that was supposed to have been done hadn't been done. So his interest in having me not go there was both related to the difficulty in getting there and the fact that he knew what we'd find when we did get there. So that was the biggest part of it. Then there were periodic meetings that I would have to go back to Patna to participate in, and reporting, and we filled out a lot of forms. But It was mostly that kind of spot checking and supervision and traveling from one health office to another in the district. I'll tell you a story about getting stuck in the mud. We were traveling to one of those outbreaks, and the Jeep got stuck in the mud, and it was clear that we couldn't go any further on that road in a motorized vehicle. And it was still quite a ways to the village that we were traveling to. But just down the road was the estate of a very wealthy landowner who kept an elephant as a pet. This was the sort of beast of burden that in past times in India was used for actually doing work. The elephants, I guess, are no longer used for work in India, or very little, but they were still, at least at that time, kept by some of the wealthy Indians as kind of status symbols. So we walked down the road. My paramedical assistant was not very enthusiastic about this, but I insisted that this would work. We walked down the road, knocked on the door, introduced ourselves. We're invited in for tea, and I asked the gentleman if we could please borrow his elephant. And he agreed, and we all climbed on the elephant, and there was an elephant driver who urged the elephant along. It was sort of worrisome because he had a metal rod, and every now and then he'd whack the elephant on the side of the head with a metal rod, and I was just seriously concerned that the elephant was going to react to this in some way, but it didn't seem to bother him. We eventually got to the outbreak, and all the kids were excited to see us coming, and they all ran around yelling, "Hati, Hati," which means elephant. And so we did our work there, rode the elephant back. And 4 years later, when I was in Somalia, somebody in the smallpox program that I was introduced to said, "Blumenthal, you're the guy who rode the elephant to the outbreak, aren't you?" So that little episode gave me a certain amount of fame in the smallpox program. So that was not a typical day, but it represented the kind of work that I was doing in India.
The word is improvisation.
The word is improvisation, right.
Do you have any other tales of your time in India?
Well, I guess there are many. One that I enjoy telling from time to time involves a visit that I was to make the next day to a village that was located on a river. And I was having dinner with a number of Indian colleagues, and I asked them, "Are there crocodiles in that river?" And one of them said, "Oh yes, crocodiles are available." And another one said, "He doesn't want crocodiles, you goof." So we got a chuckle out of that one.
But you lived to tell the tale.
But I lived to tell. I actually never saw any crocodiles. I suppose they were available, but I didn't see any. So I would have to say that period of time that I spent in India was one of the most rewarding of my professional career, and the reason is this: that when I got there and began visiting these outbreaks and visiting villages, there were so many outbreaks and so many cases of smallpox, and it was such a terrible disease that I said to myself and to others, "This is absurd. This is never going to be eradicated. There is no hope for success here. This is an interesting experience and a great adventure for me, but I can't imagine that this is going to succeed." And yet by the time I left, only a few months later, I couldn't find a case. It virtually disappeared before my eyes during just 3 months that I was there. And I would have to say that that's the part that I remember most. That was the most satisfying part of that experience.
It was an achievement. You mentioned you were in Somalia.
I was. 4 years later, honestly, what happened was 4 years later, I just decided I needed to go to Africa. I had never been to Africa, and it was a place I wanted.
Were you still part of CDC?
No, at that time I was no longer working for CDC. I was working for Emory University. But nonetheless, word reached me that CDC was looking for people to go to Somalia. This was what appeared to be the last outbreak of smallpox, smallpox's last stand. And I really not only wanted to go to Africa, but when I heard about that, I wanted to be part of that. I was hoping to get there in time to see the last case. So I succeeded in getting a period of leave from my position at Emory and signed up and went to Somalia a bit too late. The last case had already taken place, so I missed that. So I spent 3 months in Somalia conducting a search, really knowing that I wasn't going to find any smallpox. So we did other things. Somebody was back at CDC, I guess, was interested in studying other pox other pox viruses. So they had me looking for camel pox, which is a pox disease of camels. And I actually found a camel that had camel pox and gathered some material from some of the lesions and sent it back to CDC. I don't know what happened with that study, but I'm sure we know a little bit more about camel pox now than we did before because of that. A story from Somalia. So the work in Somalia was fairly similar to the work in India in the sense of going around and checking to make sure that in this case, that the search had been done properly because there wasn't any smallpox to be found. So in one local health office, I went through my routine of identifying a place that I wanted to visit and having the health officer there explain that this was a very difficult place to reach, and so I probably shouldn't go there, and having me say, well, in that case, that's definitely the place I want to go. So my job was to go to the place and take the little smallpox picture that we used and go from one dwelling to another, asking if somebody had been there, showing this picture and asking about any cases of rash. Now this was in a part of Somalia that's called Ghetto, and I'll digress at this point to say that on my way to Somalia I had stopped in Geneva for a couple of days to I don't know, fill out some forms or something at WHO. And one of the people who was returning from Somalia said, listen, when you get there, you can go to any part of Somalia. It doesn't matter where they assign you, as long as it's not Ghetto. You don't want to go to Ghetto. So, of course, when I got there, that was where they sent me. This was a fairly remote part of a remote country located where Somalia, Ethiopia, and Kenya all meet. And it was a little risky because there was a bit of a war going on at the time between Somalia and Ethiopia over the Ogaden Desert. I'm not sure why anybody would want the Ogaden Desert, but both of these countries did, so they were fighting it out.
Still do.
Yeah, so we had to stop from time to time because we were told there were landmines in the road up ahead, and so we'd spend the night by the side of the road, and the next day we were assured the landmines had all been cleared away and we would go on. I'm off of my story. The story is, and now I need to further explain that the populace in this area was mostly nomadic, and they would herd camels and some goats and some sheep from one place to another, looking for food for the livestock, and they would set up their huts and stay in one place for a few days and then move on to another place. This was the dry season, and there were some places that were where food for the livestock could be found, and there were other places where no food for the livestock could be found. There were some settled villages along a river that flowed through the area, but mostly the population was nomadic. So with this as a backdrop, I will return to the story where I had identified the place that I wanted to visit, and so myself and my driver and my interpreter and the local health officer all set out in our Land Rover to visit this site. And we traveled for a long way in the Land Rover, and then we got to a place where the health officer said, you know, I really don't know this area. We'll have to find somebody here, a local guide, who can take us to the place where you want to go. So we hunted around. We found somebody who said he knew where that place was, and so we put him in the Jeep, in the Land Rover, and we drove until we came to a dry wadi, which is a dry riverbed, a gulch. In the dry season, there's no water in it, but we couldn't drive across it, so we had to leave the Land Rover there. We got down and we walked. We probably walked 5 miles, and it was hot and it was dry, but we finally got to a place where our guide said, "Here we are." And I said, "Where are we?" He said, "We're at the place you said you wanted to go." And I said, "But there's nobody here." And he said, "Well, of course not. There's never anybody here this time of year." So all I could say was, well, I guess there's no smallpox here. And we turned around and walked back. So that was Somalia. I met bedbugs in Somalia. I had never seen bedbugs before, but traveling around from one place to another in some of the little towns, there were little hotels, and we stayed in a little hotel, and some of the little hotels had bedbugs. So that was.
And you had bedbugs?
I had bedbugs. The bed had bedbugs, and they came out and fed on me. It was my experience with bedbugs was I woke up in the middle of the night, and my first experience with bedbugs, I woke up in the middle of the night and I was being bitten by an insect, which I thought must be mosquitoes. So I pulled my cover up around my head, and the more I pulled the cover up around my head, the more I got bitten by the bugs. So I finally got out of bed, got out my flashlight and shone it around and found bed bugs. I'd never seen them before, but I figured out what they were. So I found ways to deal with the bed bugs after it. But basically, I just sort of coated myself with insect repellent, and that kept the bed bugs away.
That's your only health problem overseas?
Well, occasional diarrhea, but I never got seriously ill during the time I was overseas. Took malaria prophylaxis. Was reasonably careful about what I ate and drank.
To what extent do you think your experience with smallpox influenced the rest of your career?
Well, I've maintained an interest in international health, and I feel like I have had more of an international health experience than many of my colleagues who also do international health, but their international health work may involve going to the capital city and giving some lectures at the medical school, and it sort of entitles me to scoff and say, "You call that international health? That's not real international health." I've maintained it has stimulated an interest in infectious disease, so although I would not attempt to pass myself off as an infectious disease specialist, it does help me keep current, and I know a lot more about infectious disease than many of my other non-infectious disease specialist colleagues. I think more than anything just given me a lifelong feeling of satisfaction that I was part of this program that achieved one of the greatest public health accomplishments ever. And I've always been glad to have that on my curriculum vitae.
Well, good. Anything else you want to say?
Seems like enough.
It's good.
Thank you.
Thank you.
Thank you for the opportunity.